Moving out of the skull now, there's a bone called the hyoid bone. What the hyoid bone is best known for is the fact that it does not articulate with other bones. So it doesn't form any joints with other bones, but instead it is kind of suspended from the styloid processes and is held in place using a number of ligaments. The word hyoid comes from the shape of this bone. The bone is shaped like the letter U. So hyoid means U-shaped. It's a very unique bone. It helps support the tongue. So a lot of muscles that go into the tongue come from the hyoid bone. It also is an attachment site for muscles of the neck and muscles of your throat or pharynx. Once you see this bone, you should remember it, as again, it is a very strange bone in that it does not attach to any other bones. One of its major purposes is to keep the respiratory tract from collapsing, and it does this by having ligaments that attach to the larynx or voice box. So it keeps that area of the respiratory tract open. It does have some certain features. It has a couple horns, a greater horn, a lesser horn, a body. But we want to remember that it does not articulate with other bones and it's shaped like the letter U. The next area we're going to get into is the vertebral column or backbone. We know the backbone is there for a number of reasons. It protects the spinal cord. In fact, the spinal cord will extend almost the entire length. It'll extend from the brain, go all the way down, and stop roughly about at this location. So your spinal cord doesn't go all the way down. It stops at about L2, which is the second lumbar vertebra. It supports your head. The skull, and specifically the occipital bone, will rest on the first cervical vertebra in your neck. It's a point of attachment for ribs. Ribs attach in the thoracic region. There are 12 pairs of ribs, and each pair articulate with one of these thoracic vertebrae. It's an attachment site for the pelvic girdle. Your hip bones articulate with the sacrum. And it's also an attachment site for many muscles. These muscles are involved in maintaining posture and movement of the neck, torso, as well as helping to move the legs. The curvatures increase its strength, help maintain balance, and help absorb shock during walking and sitting. The regions of the vertebral column include the cervical region, which has 7 bones, C1 through C7. The thoracic region, which has 12 vertebrae, called T1 through T12. The lower back area, called lumbar, has 5, L1 through L5. There's a single bone known as the sacrum, but it is actually a fusion of 5 vertebrae. And then finally the coccyx, which is a small tailbone, which is formed by the fusion of anywhere from 3 to 5 small little vertebrae. There are some anomalies with the curvature of the vertebral column. Scoliosis is a lateral curve. There shouldn't be any lateral curvature to the vertebral column. When this does occur, the biggest concern is compression of the spinal cord. An exaggerated thoracic curve is known as kyphosis, often referred to as hunchback. And then an exaggerated lumbar curvature is known as lordosis or swayback. We're going to first look at a typical vertebra and learn some of the basic structures that are found in most vertebrae. And then we're going to look at each region, cervical, thoracic, lumbar, and identify modifications or changes that might occur in those different regions of the vertebral column. So a typical vertebra is going to have certain things in common. They will have a vertebral foramen. The vertebral foramen is going to be the whole central hole, and inside that vertebral foramen is going to be the spinal cord. They're going to have all except C1 is going to have a body. The body is kind of the larger weight-bearing portion of the vertebra. They may or may not have a spinous process. The spinous process is going to be projecting posteriorly. Projecting laterally are going to be the transverse processes. So in this typical thoracic vertebra, we have one spinous process and two transverse processes. They will have facets. A facet is a small, fairly flat surface to form articulations or joints. The vertebrae stack on top of one another. And how they stack is they have articular surfaces called facets or facets. The superior articular facets will be for whatever vertebrae attaches to the top of that vertebra. On the bottom of this vertebra, we would see inferior facets in order to form a joint with whatever vertebra is found underneath this one. So in the lab, it's very useful to find a number of vertebrae and stack them together. And as you stack them together, you will see the articular facets forming the joints. Over here, we see this yellow structure represents the spinal cord going down the vertebral cavity or the vertebral foramen of these three vertebrae. But you need to get nerve impulses into the spinal cord as well as nerve impulses out of the spinal cord. That's done using spinal nerves. These spinal nerves gain access to the spinal cord through holes formed when two vertebrae come together. So those holes are called intervertebral foramen. An intervertebral foramen is formed in between vertebrae. So that's the important difference between these foramen and the vertebral foramen. Notice that there are small little facets or facets on the body of this vertebra as well as on the transverse process. Those facets are for ribs. And that's how I know that these three vertebrae are all thoracic vertebrae, because only the thoracic vertebrae would have facets for rib attachment. And when we get to ribs, we'll learn that ribs actually have a couple areas on them that make contact with vertebrae. They make contact at their head, as well as they make contact with a little structure called the tubercle of the rib. Here's what might happen if there is a lot of stress on the vertebral column. We could get what's called a herniated disc. A herniated disc is when a component of that intervertebral disc gets pushed and compresses either the spinal nerve or the spinal cord. Looking at an intervertebral disc, there are two regions. There is the outer annulus fibrosus and the inner nucleus pulposus. You'll notice that this nucleus pulposus was forced out and is making pressure on the spinal cord and spinal nerve. Very painful. In the next video, we're going to focus specifically on the cervical region of the vertebral column.